You are just tuning in. This is Citizen TV Daybreak. We were just having a conversation with Seth Panyako. He's the Kenya National Union of Nurses Secretary General. Under him, he has about 30,000 nurses. And at the end of the day, we both know that nurses and doctors are at the forefront of COVID-19. Panyako, thank you so much for sticking with us. I believe now our audio is back and clear. Allow me to for the sake of the audience, allow me to repeat my very first question, what it is you're hearing on the ground, what your nurses are saying from across the country.
What we're hearing from the ground is that personal protective equipment remain a challenge in most of counties across all health facilities. I have information that the only county that appears to be very much ready is the county government of Mombasa, which appears to be ready. It has provided PPEs for the health workers together with ventilators, and it's very much ready to tackle COVID-19 if there's an outbreak like the one in Nairobi. Another county that has indicated that it's ready to deal with this COVID-19 is Machakos County Government. But the rest of the county governments across the country, the information is they are not ready. They do not have personal protective equipment. Most of the nurses who are not, most health workers who are not nurses, do not know what is required of them in the process of attending to COVID-19 patients and how they can protect themselves and protect others.
So if that's the case, on a day-to-day basis, what are nurses doing then? With the cases in Kenya going up, what does the normal day look like for our nurses then?
What is happening is that, you know, we are not yet in a crisis in Kenya. But from the trend, the way things are moving, if we continue like this in the next 1 month, we are going to have a crisis.
Okay.
That is basically when we shall be able to have the crisis brought right at our doorstep. The kind of carelessness that our people are exhibiting, even as the government also is exhibiting carelessness, might plunge this country into a very serious health crisis, because we are not ready to handle a serious outbreak that we can have 10,000 people infected in the country, as the minister had predicted. It will be extremely difficult for us to handle that.
Okay. Sec Gen, here's the thing. The fact that some Kenyan nurses refuse to treat coronavirus patients to protect themselves because of the shortages of the equipment, the PPEs, is that the best way to handle this?
It is not shortage. It is absent. Absolute.
Okay. All right, we seem... Okay, so we have lost Seth right there. We'll try and get him back via Skype. He was just letting us know the fact that it's not an issue of shortages. Okay, we still have Panyako. Panyako, thank you so much for sticking with us. We tend to have lost you there a little bit. Allow me to pick it up from that last question I had asked you. The fact that you were telling me it's not an issue of shortages on the ground.
Shortage is not an issue, because when you say shortage, it means we have some. But where there is completely nothing to be used to protect yourself as a health worker, our advice has been run away. It is provided for in the Occupational Health and Safety Act, Section 13 and Section 14. Section 13 says it's the responsibility of the employer to ensure that the working environment is safe, to provide the equipment and the machinery or the protective care, so that any worker, not only health workers, at the working place or the working environment is safe for the employee to deliver his or her services. And if that is not available, then under Section 14, employees are allowed to move away from the workplace, which is considered as harmful and dangerous. There is no way as a leader I can allow nurses to work in an environment which they can easily infect themselves.
Right. And Panyako, I hear what you're saying. You need to definitely protect the lives of your nurses. But at the end of the day, one will ask, did nurses not take a pledge, an oath to protect human life?
Of course, we did take a pledge to protect human life, but we never took a pledge to expose ourselves so that we can get killed. You can imagine if you use Ngara Health Center as an example, where you have health workers infected and the entire facility is actually closed down. Now, if it's the village, that's the only facility available, for example, in a sub-location, and it has been closed because health workers are infected, the members of the public are infected, who will take care of who?
Right. At the end of the day, Panyako, our nurses continue to treat Kenyans and non-Kenyans on COVID-19. Are they quarantined at the end of the day, those same nurses? Talk to me about that.
Today? Repeat your question.
My question is, at the end of the day, when nurses treat patients, are they themselves quarantined? Is there a space period before they can go back to the field?
No, I have been talking about this thing right from the beginning. I said, and as a union, we have said, all frontline health workers, not only nurses, who are coming in direct care of these patients at the casualty as well as in the isolation departments should be quarantined, and every 14 days they should be tested to ensure that to check care of to ensure that they are not infected, and if they are infected, they are immediately put on management.
And Panyako, is that the case? Is that the case for our nurses? Are they being checked after?
That's not the case. We do not even have any isolation area. When you hear someone telling you that if you suspect you are infected, you have to go to a designated place. Where is this designated place? The government is not taking trade unions seriously when we tell them things to be done.
All right. We seem to have lost network with Seth Panyako there, but he was just letting us know what's the case for the nurses on the ground. But before that, let me just, as we try and get Panyako back, all right, we seem to have him back. Excuse us with our network here, but we are really adamant to make sure that we get this interview to you.
This is the problem of working at home. You know that people already calling me, and when they see me on TV, they want to talk to me when I'm still in studio.
Oh, all right. Okay, so ladies and gentlemen, try not to call the Secretary General. He's currently using his phone for the Skype interview. Kindly try and not call him so we can sort of finish this conversation. Sorry about that, Panyako. But yes, you were talking to me about the fact that nurses are not getting the treatment, the quarantine treatment that they deserve after treating patients. You were on that note.
Apart from that, we are saying there is not any measure that has been put in place to ensure that nurses and other frontline health workers are protected, and they feel confident, and they feel the government does appreciate what they are doing. Nothing completely. We have even been talking about the issue of commute allowance, where now the commuter has doubled. We have been asking the government, why can't you now double commute allowance within this period? Nothing. No one is responding. No one is acting. We have also been talking about long working hours. Frontline health workers, especially the nurses.
But here's the thing, Panyako. You say that your health workers, the nurses, are not quarantined after testing patients. But according to Dr. Patrick Ambolo, the Ministry of Health Director General, says that healthcare workers who get into contact with these cases do not go home but go to specific places and therefore prevent cross-contamination with members of the family and public. So who are Kenyans supposed to listen to here?
I have every reason to believe that a government official is not supposed to mislead the public. And that doctor is definitely misleading the public, because you are aware that after that child died in Kenyatta National Hospital, level 4, it is when they put those health workers who came in contact with this baby under quarantine. Now, let me ask you, before this baby died, had they put anybody in quarantine? He is not even telling us, like in Kenyatta National Hospital, Kilifi, in Kilifi County, Mombasa County, and Kwale County, he is not telling the members of the public where is the specific place that these nurses and the other health workers who are directly in charge of managing these patients are supposed to go.
Okay. And Seth,
is there any provision that has been placed by the government?
Okay, Seth, at the end of the day, how many nurses do you have currently working, and how many more do you need?
According to WHO, we are supposed to have a ratio of 25 nurses per 10,000 population. We have 8.3 per 10,000 population. If you calculate the number of nurses needed as by the WHO, it means at a population of 48 million, we need about 120,000 nurses working in Kenya, both in private and public sector. What we have today is 48,000 nurses. It gives us a shortage of 62,000 nurses. And if you say that the public is supposed to have about 33,000 nurses, then the rest should be in the private sector. So we have a shortage of 62,000 nurses in Kenya.
62,000 nurses in Kenya, according to the World Health Organization, 25 nurses to 10,000 population. Here's the thing, Panyako, you were quoted recently saying, and I quote, nurses in Western Kenya town of Kakamega and the coastal town of Kilifi ran away with patients with coronavirus symptoms came to their hospitals over the past 2 weeks. Could you clarify that statement?
Of course, that's very true. And we saw the branch officials actually spoke to the media and confirmed that they were not ready and they're not going to work and attend to patients who are coronavirus suspects when they do not have personal protective equipment and when the government has not put anything in place. We have even asked the government to put in place life insurance for frontline health workers so that in case one of them passes away, their family will be taken care of, but nothing is happening. We are also, as nurses, being paid very minimal risk allowance of 3,850, when actually those who are on the third line defense are earning 20,000. When we ask the government to equalize this thing and make it equitable for all health workers to feel they're appreciated, nothing is coming from the government. The government seems to be ignoring health workers. The government is just waking up and making directives without even looking at the welfare of the nurses. Look at what the president did the other day. He gave money to artists, musicians, maybe perhaps Jacko is a friend of the president, and that's why his area of profession received 100 million. What was there for health workers? Nothing. 10 million went to elderly people and the rest, while the health sector was given 1.2 billion.
All right. Okay, so we seem to have lost him one more time again. We'll try and get him. He was just explaining to us the issue of the lack of healthcare workers. We need about 62,000 nurses here in Kenya. According to the World Health Organization, at least 25 nurses to 10,000 population. Panyako, you still with us? Can you hear me?
I'm still with you. I can hear you clearly.
Okay, beautiful. So yes, here's the thing. When you told the Ministry of Health the issue of compensation for nurses who lose their lives during this time of COVID-19, what was the government's response on that?
The government has remained indefinitely silent. It has deaf ears. The government is not listening to us. It has not even bothered to listen to us. Look at the Return to Work Agreement that the government politicized. Some fellows in the Council of Governors politicized. It has not been implemented. While we remain to be the frontline healthcare workers, whenever you hear of a frontline healthcare worker, the first person to mention is a nurse. And yet when it comes to the issue of being listened to, sometimes you don't even need money. You need someone to listen to you. I thought that I had high hopes in Honorable Mutahi Kagwe when he was appointed as a cabinet secretary for health, but I'm getting disappointed in what he's doing. In fact, I will say the former minister, who is the minister for transport today, and the one who is at World Health Organization, were doing much better than the immediate former CS for health and the current one. If you don't listen to health workers, you are having trouble.
Okay, I hear you on that front. Could we also discuss the issue of working hours for our nurses right now? What are the working hours for our nurses looking like? Do they have a time to take a break now that you need about 62,000 nurses?
Not of the one I know, because if you are coming to work at 5 p.m. in the evening and you are going back at home the following day at 8 a.m., that keeps you straight 15 hours of working. There is no any measures that has been put in place by the government to ensure that nurses are protected. You remember, nurses are the only health workers within the health setup that are involved in intensive care. Their work is involved in manual, because you have to lift patients, and therefore you get fatigued, you get worn out, and at the same time you are working long hours without meals. We have a feeling that we have a government that is insensitive. It has closed its ears, and the eyes is not hearing, it's not seeing. But when you look at, for example, you review the death of health workers in Italy, one of the main cause of the death in Italy is fatigue, because of working long hours, overstretched and understaffing. So we want the government to listen to us, and if it's not going to listen to us, one of the things I'm not going to do, because I don't want to issue a populist statement, so that my members can be happy that I'm representing them.
Yes.
We will not be calling nurses not to work.
Okay.
Even if Even if the government subject us to horrifying working environment, we are in a war, we are the frontline soldiers, and we cannot allow to put our country at risk.
Seth, even during such a time as this, a unique time like this, a pandemic, it's not every day that you hear or you get a pandemic of this magnitude.
That is exactly why I have said, as the frontline soldiers, we are not going to let our country down. We will work, and once the pandemic is controlled, the government is going to face a re-energized, a focused nursing workforce in Kenya that will demand for their rights, and we will not look back.
Right. All right, Sec Gen, we need to sort of close off the interview. My last question will be perhaps, how can we strengthen our healthcare system so tomorrow if another pandemic comes, we're not back to square one? And what's your advice to the public? Earlier on, you stated the carelessness of the public being a concern as well. Could you just touch on those two issues as your final remark?
First of all, to strengthen healthcare system in every government, it requires that you look at key components that makes healthcare system to be termed as sound. One of them is human resource, very important. In the nursing, we have even discrimination against nurses who have bachelor's degree. When the government wants to hire the 6,000 nurses, we are seeing them discriminating against nurses who have done degrees. That's already a demoralization. You look at the financing. Fund healthcare system to the levels required. Like in Africa, you have to fund healthcare department at the rate of 15% of the general public. Number two, look at the infrastructure. And provision infrastructure and medicine and the rest must always be at the level that is acceptable. So there are about 4 pillars, as I've said, that requires to put it into consideration for you to have a sound healthcare system. Okay.
All right. Thank you so much, Sec Gen. That's Seth Panyako.
The last question I did respond.
All right. Okay. Go ahead. Yes.
What was it for? If you can remind me. There were 2 questions. I've answered one.
Yes, the other one was the issue of the carelessness from the public as well. You had touched on that, the carelessness of the public.
Exactly. I want to tell the members of the public, you must respect the directions and guidelines being given to you by the government. Yes, it's true, our government has some mistakes it's making. But when you are told to wash your hands with soap, please wash. When you are told don't go to supermarket with your children, don't go. I was in Kakamega the other day and I was so surprised that all supermarkets in Kakamega are not observing any social distancing measures put in place in government. It's allowing children in the supermarkets, allowing everybody there, no masks, no nothing. I think we must follow guidelines given by the government and health workers, and especially the Ministry of Health. We have no option. COVID-19 is a dangerous disease, it's a killer, and it will kill you, and it will wipe out this population if we don't become serious as Kenyans and observe simple protective measures.
All right. Thank you so much, Sec Gen. That's Seth Panyako. He's the Kenya National Union of Nurses Secretary General. A lot of things have really come out from our discussion, despite the network issues. He's talked about the compensation of health workers, nurses who have had to lose their lives or have lost their lives at the forefront of COVID-19. Government needs to do something about that, but also he's told us that the World Health Organization, the quality is 25 nurses to the 10,000 population. So far, Kenya has a shortage of about 62,000 nurses. That's Seth Panyako, Kenya National Union of Secretary General. Let's take a quick commercial break. When we come back, Trevor Mbija will be speaking to Thurunira Kaguria. He's the KMPDU Nairobi branch secretary, just on the issue, the same things that we've just discussed. But he'll also be touching on the issue of fake news. A lot of videos and stories have been going around regards to COVID-19. We'll be talking about that in just a little bit. Let's take that quick commercial break.